If you feel like you can hardly walk when you first get up, then this video is for you. Whether it's first getting up in the morning, or whether you have trouble walking when you first get out of the car, or whether you're eating at a restaurant and then you have trouble getting back up and walking and you feel like you have to walk bent over for the first couple steps, the tips in this video will help you out. I'm Dr. Dave Candy, and in this video, I'm going to explain a really simple method to help you get up and start walking without feeling like you have to walk hunched over or without having pain in your back, hips, knees, or feet when you start walking. So before we can go over how to relieve pain when you start walking after standing up, first we have to figure out what's causing it. And largely that's stiffness in two muscle groups: your hip flexors and then your calf muscles. Now, I've got another video that helps explain some sleeping positions that will help keep you from getting so stiff and painful when you're sleeping. But I want to go over in this video sitting positions, because your sitting position affects the way that you're going to feel when you stand back up. So first we're going to go over how to sit in order that you feel more comfortable when you stand back up. Now, your hip flexor muscles run from your trunk down to your legs. And most people think of hip flexors as muscles that lift your hip or flex your hip like this. However, your hip flexors can also work in a reverse action as a postural muscle. And that's very true when you're sitting, particularly if you're trying to sit up tall with good posture, or particularly when you're sitting without back support while you're sitting up tall. Your hip flexors, because they attach to the front of your spine, they help hold you in that arch position. Your hip flexors help keep you from falling too far backwards, and at the same time, your trunk extensors help keep you from falling too far forwards. So you're co-contracting your hip flexor muscles and trunk extensor muscles in order to keep you in an upright position while you're seated. So if you're constantly using those muscles while you're sitting down and they're in a shortened position, then when you go to stand back up, those muscles that have been tight under tension for a long period of time in a shortened position, they're going to have trouble lengthening back out to allow you to stand back up straight. And that's why you may feel like you have to kind of walk bent over for those first couple steps. So one easy way to get your hip muscles to relax when you're sitting, so they're not under quite so much tension the entire time that you're sitting, is to make sure you're sitting all the way back against the backrest. Now, they're still in a shortened position, but if you can allow yourself to fully relax into the backrest, where you're not using these muscles as postural muscles, they can at least be relaxed. Now, the next thing to look at is your calf muscles. If you're driving in a car with one foot on the gas, you're pointing your toes or plantar flexing your toes, and the other foot's usually out trying to support you. And so your toes are in a pointed position like this, which puts your calf muscles in a shortened position. Likewise, if you're sitting in your chair and you have your feet out in front of you like that, or you don't have your knees bent 90 degrees and your feet flat on the floor or flat on the step stool, then that's going to put your calves in a shortened position. And even in the best case scenario, if you do have your feet bent to where your knees are at 90 degrees and your ankles are at 90 degrees, they're still not in a position where they need to be in order for you to walk. So naturally, your hip flexors and your calves will stiffen up a little bit when you're stationary. And that's whether you're laying down in bed or when you're sitting for a long period of time. But they're going to stiffen up even more if you sit with them in a shortened position where they're under tension, working as a postural muscle the entire time. So when you go to stand up, a lot of people notice that they either have trouble standing up in the first place, where they get a catch in their back, or they notice that they can get up, but then when they start to walk, they have difficulty taking that first step. And they feel like they kind of have to walk bent over or hunched over for the first few steps. So next, after fixing the sitting position, we want to go through how to stand up without your back bothering you. So scoot to the front of the chair, and you want to hinge your hips forwards like this. You don't want to round your back that way, but you want to keep a straight spine and bend forwards this way. Now at the same time, you want to pull your feet back underneath of you so that you're getting your center of gravity over top of your feet. And you can see here with fairly minimal muscle effort, this is really just gravity and leverage working. Your weight starts to go over your feet with almost zero muscle effort. Now there's the fear that you're going to fall forwards, but that's physically impossible. You'd have to go really, 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 really far forwards in order to fall forwards on your face. The bulk of your center of gravity is behind you, and so if you're going to fall, you're most likely going to fall back into the chair. And if you start to feel yourself falling forwards, you're likely just going to sit back down because you don't want to hit your face. So it's a very safe method to do that requires fairly little muscle effort. Then, once you get your weight over top of your feet, then you just push your hips underneath of you. And this is the sticking point where a lot of people have trouble when they start standing up in order to walk. Is that a lot of people will either go up straight like this, which jams the joints together in your lower back, or they'll do the standing correctly, get their hips underneath of them, and then come all the way up, in which case they're still jamming their joints in their lower back together. And because your hip flexors have been in a shortened position while you're sitting, as you go to stand up all the way, your back starts to arch. And that's why a lot of people feel like they need to walk bent over for the first few steps, because their hip flexors haven't quite stretched out yet. And so in order to keep your hip flexors from bothering you when you first stand up, do that hip hinging motion. Come up about 75% of the way. Don't come all the way up there because now you're already in trouble. So come up about 75% of the way. Then take a small step and roll your pelvis underneath of you. Another small step, roll your pelvis underneath of you. And so you're going to be bent over for the first 1, 2, 3 steps. And during that time, you're actually sort of doing an active hip flexor stretch, hip flexor stretch, hip flexor stretch, in order to allow you to come back up comfortably. Now, what about your calf muscles? Like I mentioned, your calf muscles also get stiff when you're sitting for a long period of time, or if you're laying in bed with your toes pointed out, your calf muscles will get stiff also. Now, when you're doing that small step, you're also kind of stretching your calf muscles out, stretching your calf muscles out, stretching your calf muscles out. Now, the calf muscles are more problematic if you get either plantar fasciitis. When your calves are stiff, they cause you to overpronate like that. Or if you have knee problems, when you can't take a step that way, your body finds a way around it by going in like that, a motion called pronation of your foot, where your knee goes inwards, and that can cause knee pain. So by taking a smaller step, those first couple steps, it prevents you from having to overpronate to take a large step. And so it keeps your knee from going inwards when you're taking a step. And so to review, when you're sitting down in a chair, you want to make sure you sit all the way back in the chair. Get your back relaxed and make sure your hip flexor muscles aren't working as postural muscles to help hold you up, because then you're going to be in a little bit more trouble when you go to stand up and start walking. Second, when you do want to stand up, scoot to the front of the chair, bring your feet underneath of you, hip hinge forward to get your body weight over your feet, stand 75% of the way up. Then take a small step, stretch your calf and hip flexor, another small step, stretch your calf and hip flexor, and repeat that for about 2, 3 steps, and you should be pretty close to all the way up without getting that sharp catch in your back. It also prevents you from overpronating and causing foot pain, for example, from plantar fasciitis or knee pain. So hopefully you did find this video helpful in order to learn how to stand up and start walking without so much pain or feeling like you have to walk hunched over for the first couple steps. Now, ultimately, long term, you do want to get your hip flexor muscles stretched out and your calf muscles stretched out so that you don't get quite so stiff when you are sitting down or when you are sleeping at night. And if you're in the St. Louis area, we'd be happy to help you out with that here at More for Life. And if you're watching from somewhere else, I've got another really helpful video to show you the one best stretch that you can use to help start walking with less pain and stiffness.